Today we're going to talk about migrant farm workers and sexual health. In regards to statistics, there's an absence of national data on migrant workers, as many are undocumented or they do not seek medical treatment, especially when it comes to sexual health. Therefore, inferences have to be drawn from Hispanic rates, and 83% of farm workers in the United States self-identify as Hispanic. STD rates are 2 to 4 times higher than whites among Hispanics and Latinos. Latinos account for 24% of new HIV cases, and as rates of syphilis are declining amongst African Americans, they're increasing among Hispanics and Latinos. Next, we'll go over some contributing factors to these STD numbers. Many migrant farm workers are living in poverty, have subpar housing, and have very low income. Many are uninsured and have very limited access to Medicaid. They have little to no transportation, therefore they couldn't seek medical treatment even if they wanted to. Oftentimes, men arrive unaccompanied by family, and therefore it leads to some social isolation. There's some lack of education and awareness when it comes to STDs and sexual health, and this is often due to limited English proficiency. There's unprotected sex, multiple sex partners, and sex with prostitutes, which leads to an increase in STD rates. Alcohol and drug use plays a factor in the decision-making among farm workers. They have intense work schedules, which doesn't allow them to take time off. And the highest HIV risk category for Latinos in the US is men who have sex with men. Here's an example of some of the migrant farm workers. A study was done in New Orleans post-Hurricane Katrina when there was an influx of migrant farm workers. In the last month, 68.9% had had sex with a high-risk partner, 75.5% drank alcohol in that past week, and 68% of those were binge drinking. 50% of farm workers had inconsistent condom use. 30.6 had no condom use during their last sexual intercourse experience, and 10% had self-reported having HIV status. Although there's a long way to go for farm workers, especially migrant farm workers, there have been some improvements that have been made over the last few years. The big problem is there's a lack of research and funding for behavioral intervention for these migrant workers. But there has been more education and training with the community health workers. There's been an increase in community awareness, and there have been many rural health projects, which will hopefully eventually benefit these migrant farm workers. Some common tips in prevention to stop the STD spread amongst farm workers are obviously condom use is a big part of this, to reduce the number of sex partners, to reduce alcohol and drug use, to get vaccinated, HPV if there are any women farm workers, and then hepatitis B if anyone hadn't had that vaccine as a child. It's important to get that vaccination even as an adult, and to get tested and seek care. And this slide has some good resources. This first link helps to find a healthcare center where you can seek out medical treatment and get tested. And the next few are just kind of some education and some tips on what to do and how to seek help and really what HIV as a whole and STDs really are. Thanks.